Hi, my name is Vitaly, and I'm the practice administrator here at the Center for Developmental Psychiatry. Today, I am excited to introduce you to one of our incredible psychiatrists, Dr. Patel. Today, we will be learning a little bit more about her approach, the types of patients she sees, and what you can expect when you work with her. So, Dr. Patel, thank you so much for being here today. To start, can you just tell us a little bit about yourself and what led you to psychiatry?
Yes, of course. So my name is Divya Patel. I'm a psychiatrist, both seeing children and adults in New Jersey right now. What led me to psychiatry? I guess when I started medical school, I always knew that I wanted to work with children. So I thought that I would go into pediatrics and maybe that would be a good fit for me. But as I went through my rotations, I realized that I really, really connected with the people that I was seeing in my psychiatry rotation. And I really enjoyed pretty much every aspect of the rotation, which it solidified for me my choice in pursuing residency in psychiatry. After I finished residency, I always had this desire to work with children and families, and that's what led me to finishing a fellowship in child and adolescent psychiatry.
That's great. That's great. So, what areas of psychiatry do you specialize in?
Yeah. So I would say specialty wise right now I feel very comfortable working with kids that have ADHD, anxiety and autism as well as working with family systems that may be struggling with behavioral challenges or challenges relating to any of those diagnoses. However, given my background in adult as well as child psychiatry, I would say I feel pretty comfortable working with people from all types of backgrounds with all types of struggles. And so there is very little that I would feel uncomfortable helping people address or navigate. But in terms of specializing, I would probably say anxiety, ADHD, depression, as well as autism.
And Dr. Patel, what do you enjoy most about working with your patients?
I would say I enjoy just working with the kids and families the most. I enjoy the emotional connection that you get to form while we work with families and children, as well as I think the impact that I have the opportunity to make when people are presenting to me. Usually, they are in a very vulnerable and hopeless position sometimes, and so I really enjoy helping bridge some communication gaps or create a more comfortable environment for people to feel supported and feel like they have the appropriate resources and tools to navigate difficult situations in their life.
And can you describe your approach to treatment and how you collaborate with other professionals like therapists, pediatricians, and schools?
Yes, of course. Working with kids and families, I think collaborating with everyone that's involved in their life is really important. Generally, when I first meet a child and their family, we start off by meeting one on one with the parents. And my goal is really to understand what is going on, get background information on the child, on the family system, and really try my best to understand all of the various things that might be impacting this child and impacting their child's emotional well-being. From there, I typically will meet with the child individually and assess for a lot of the things that may be contributing to their current struggles. And then at the end, when we're creating a treatment plan, oftentimes I will ask the parents their permission to be able to speak with the school or speak with a therapist or very any individual or entity that might be involved in the child's life that can provide more information to me as well as help me help the family a little bit. So I really have an open collaborative approach for everyone, and I think that's the best way to really help everyone feel supported and help in creating a more holistic, wholesome approach to treatment.
And how do you tailor treatment plans to fit the unique needs of your patients?
I think one of the benefits of private practice and seeing kids at this clinic is that I have plenty of time to really get to know the family and really get to know the child. And I do think that everyone has different needs and different openness and availability emotionally also to access some of the recommendations that I might want the child or the family to access. And so I really try to understand, where the gaps or the barriers might be for the family or the child to access resources. I might try to understand the child's ability to engage or get help from some of the recommended resources and go from there. Typically, I really try to have an open conversation with the parents and the child to make sure that whatever I'm recommending is something that is feasible and makes sense logistically in their lives. I think oftentimes the logistical aspects of getting therapy or getting access to some treatments is difficult for people. So I really try my best to get all that information, spend enough time with everyone to understand where the gaps might be and what I can do in my capacity to help reduce some of those burdens.
And what should a new patient expect in their first session from you?
So in the first session, like I said, typically I will choose to meet with, if it's a child, I'll choose to meet with the parents first. If it is an adult, then I will meet with the adult, obviously for 2 sessions. And then the third session, we will really work together to formulate a treatment plan. With children and families, the reason I like to meet with the parents first is, again, to get background information on why they're seeking this consultation. And so that way we have an outline of all the goals that they may have for the assessment, and clarifying any questions that they may have about the assessment. Typically, it is a lot of me gathering information in the first session. So it's a lot of me asking questions and trying to understand, what are the reasons you are coming into the office seeking this consultation. As we get further into treatment, it will be a lot less of me talking and a lot more information that, the child or the family will be sharing. But typically in the beginning, it will be a lot of information gathering, a lot of collaboration. And that is, again, to ensure that we have all the information we need to best support the family and the children, as well as create an individualized treatment plan that makes sense for the person that's coming in.
How do you help patients feel comfortable opening up about their mental health?
I think, generally speaking, like I said, I really try to keep the interview as low stress as possible for children. I oftentimes, for a lot of kids, this is the first time they are speaking to anyone about their feelings or talking to a psychiatrist or a doctor about some of the struggles that they may be experiencing. And so, depending on the age of the child, if they are young, I might try to do play therapy or engage them in play and observe their behavior that way. If it is a teenager who is struggling to open up, I will oftentimes use a lot of the beginning sessions to build rapport with the teen, really try my best to create an alliance that they feel safe and able to share some of these struggles with me. I also always emphasize with parents and children that this is a safe space, and I always respect confidentiality, especially for the older kids. Sometimes it does put them at ease to know that much of the things that we would be discussing would be protected and that would not necessarily be shared with anyone without their permission. Of course, barring any safety concerns or anything that I have to collaborate with parents or teachers on, I often find that this kind of relieves stress for some kids and helps them open up a little bit more.
And what is something you wish more people knew about psychiatric care?
It's a good question. I would say probably that you don't have to, I think that people associate psychiatrists or psychiatric care with medications and I think multiple medications and side effects and a lot of these fears that are valid and definitely come up during treatment. But I do wish that people had more of a understanding of the comprehensive training and education that psychiatrists have and the background that we do have in learning about children's development, family systems, and all of these other things that might impact a child's well-being. And I think that some of the input that we can provide to families beyond medications, relating to parenting, relating to communication, relating to relationship stressors stressors, a lot of these things can be just as valuable and just as impactful in helping the child navigate some of these struggles. So I do wish that that was something that was more talked about or more accessible to everyone. And maybe that also puts everyone at ease that coming in for a consultation or talking to a psychiatrist doesn't necessarily mean that they will be forced or have to start medication. I think it just means you're getting access to expertise about your child's emotional needs, which may or may not include medication.
And how would you decide when medication is the right choice for a patient?
My personal practice is always to engage in collaborative joint decision making, right? I think that as a doctor, I can provide my expert opinion of whether or not medications would make sense in this scenario. I can really walk families through the risks of the medications, the benefits that we would expect from medications. But at the end of the day, I really understand that this is a really difficult decision for most parents to make and a hard first step. And so typically, I really try to understand what the family's needs are and go from there. If they need more psychoeducation around medications, if they need more time for therapy to try if the behavioral interventions are working, if they need a little bit more one-on-one guidance on their parenting style. I'm happy and willing to work with every individual family in that way. In terms of the medications, again, I think talking about the options, talking about the specific risks associated with it, oftentimes helps people feel a little bit more confident in their decision. And oftentimes, I think knowing the data and the science behind some of these medications is also very helpful. And I think that's where I can come and really provide some evidence-based information to families. Whether or not they decide to start a medication is, of course, going to ultimately be their decision, but this way they get to make the most informed decision for themselves.
Okay, and so how long does a child need to be on medication for?
That's a great question. It really, again, it depends on the child and the family. I would say usually, especially with young children and children who are struggling developmentally through certain difficult periods of time, medication doesn't have to be permanent, right? We know that most children are able to come off medications once they're stable and once the problems that they came in with have resolved. In my practice, again, I'm always evaluating and reevaluating the need for medications, therapy, and any sort of recommendation I might have is always individualized. And so I would say if that is a concern, you can expect to have that conversation with me. And as always, we would outline the risks of stopping medication, the benefits of stopping medication, and ultimately make a decision together that makes the most sense. Typically, if the child has been doing well for a year and things have been headed in the correct decision, in the correct path, then I think that I always enable parents to try reducing the medication or try taking the medication off and see how things go. I think it's really helpful to have this space and have my support in case things do go poorly or in case this child does struggle again, you have the resources and the help that you might need to kind of reevaluate the need for medicine.
And after the intake session, how frequent do follow-ups usually happen?
That's a good question. I think it really depends on, again, what you're coming in for. Typically, on average, I like to see a follow-up within the first 2 weeks after the intake. And that's really for multiple reasons. But the most important reason is that if we're starting medication, that's a period of time where you might experience the most side effects or the most questions. And I want to make sure that you have a session to address any of those concerns or side effects if they do come up, as well as for me to get to know your child and your family better so that I can address any other concerns that I might notice, or at least, understand whether or not the treatment plan we came up with is continuing to make sense. So I would say in the beginning of treatment, the follow-ups would be a little bit more frequent. And as I get to know you and your family better, they would probably taper off a little bit. At the least, I like to see all my kids at least once a month, just to make sure that things are going like we want them to go, that they're not experiencing any side effects, and that they're doing well in all of the aspects of their life. It also, I think, helps create a space where they have time to talk about things if things are difficult or stressful things are going on.
And can you just tell me a little bit about what makes this practice different than others?
Yeah. I think that the biggest thing we have that is different than other practices is time. At least for myself, I genuinely try to be in constant communication and contact with all the families that I'm working with. They have access to me, for any questions or concerns they may have, even after the evaluation. And in terms of the length of the sessions, typically we spend 45 minutes each time we see the families. And again, it's to ensure that we're not missing any information, and it's to ensure that the families and the patients coming in have enough time to voice their concerns and feel heard. I think oftentimes when people go to see a psychiatrist or even a therapist, they may not feel that they have enough time to address their concerns or have enough time to really explore some of their worries. And so my goal is always to create that space and that time. And I found that helps minimize side effects. It helps minimize distress around medications, and in long term helps people feel better faster, actually.
Okay, great. And then finally, how can patients or families get the most out of their care with you?
Um, I think that just showing up, right? Making the appointment, coming with an open mind. I think oftentimes people come with a lot of fears that are valid. Like I said, this is a big, important decision, whether or not, you want to seek treatment even for your child, or what that treatment looks like. But I would say come with an open mind. I really try my best to create an environment that you will feel supported and that you will feel like you're making the decision that's best for your family. And so that would be my advice, to keep an open mind and see, if this is the right fit for you, and if this is the right, treatment plan for you.
Wonderful. Dr. Patel, thank you so much for your time. This was so informative, and I'm sure whoever's watching is going to take a lot out of this. So, of course, Dr. Patel is available to accept new patients at this time. As you can see, she's so wonderful, and we do welcome you to send us an email or give us a call. We are available. So, Dr. Patel, thank you so much.
Yeah, great. Thanks, Natalia.
Alrighty, you have a good one.
You too. Bye.
Bye bye.